Jyoti, there's a light behind you due to which.
Okay. Okay, let me turn this side.
No, I think that will be much better.
Sure.
There you are. Much better. Much better. Oh my God.
Okay.
Now we can see you.
I can see you now. Yep.
I can do the same thing. I think I also have a background light.
Oh, you're okay. You're okay. You can just switch that.
Right, yeah. Okay. 5:30. Yeah.
Is it 5:30?
Sunil, do you want to start the meeting?
Oh, why don't I kick it off, Raman? I think we have an agenda. Anjan is there. We have quite a few folks who attended. So again, this is the first remote video session. Looks like it's working well. Touch wood. And over to you, Raman.
Okay, thank you.
Hey, Sunil. Hey, guys. Badri here.
Hey, Badri.
Okay. So, Badri, we're just going to get going. Another, yeah. So, I'll just give a little background, and then by the time I turn it over to Sunil, we'll have people join as well. Yeah, but it's a good idea that we start and end on a timely basis.
Hello, everyone.
So good evening and welcome to all of you. Anjan, Alok, I see over here. I see Jyoti, Sunil, Neetu, and the rest of our family of charter members. Yeah. So Anjan is the initiator of the Tech CEO Circle for experience exchange and transfer of best practices that are particularly applicable to the leadership and growth of our tech enterprises. And the idea that Sunil had was to open this up to our charter members whenever the topic is of more general interest. We appreciate our charter members. We love our charter members. And this topic is certainly of general interest, much wider interest at this point of time. So with that, I will turn it over to you, Anjan, to introduce the topic and lead the discussion. So over to you, Anjan.
Thank you very much. And I must say that, Raman, you've been the inspiration behind it. And thank you very much for giving us all the ideas and giving me the guidance to get where we are. Just very quickly, briefly on this, and then we'll get into the topic. There are so many issues, topics that we need to talk as people who run companies, and it's sometimes nice to share. There are, of course, many avenues that we all have. Within TiE, we have such a good, diverse set of personalities and people and companies. It will be good to get together on a regular basis. And of course, right now, there is no other topic on the agenda. There is nothing else that is getting any oxygen than what is really sucking all the oxygen, from the air for all of us. And I want to spend the next 45 minutes to an hour based on questions, on talking about the current crisis, which of course all of us know about. And as Raman and I were planning and talking about this, the key thing is not to spend time on what all of us know and reading. I think the joke that I heard was that somebody said that, hey, last 3 minutes I've not received any update on coronavirus. Am I the only person alive? So all of us are consuming, I think it's almost like September 11th, when for 48 hours, just to do nothing, but now we are beginning to make sense. So maybe if we can, spend the next 5 minutes or so, 1 hour, to talk about what are the issues, how are all of us dealing with it. We have, of course, all the TiE, members here. I've also, invited. I'm so happy that Alok has joined us, and we will go around. I'll introduce people, and we'll go around a little bit. But the topics that we, wanted to address, and I'm just repeating from what we have sent out in the agenda. Employees, effective communication with employees. What are we doing? Steps to protect employees, etc. Remote working. What are some of the issues? Business development. How do you talk to a customer about business development? I know what has happened to many of the proposals we put out there. Orko and I were talking on a very interesting topic here on, what is the horizon? of this? Is it 1 week, 2 weeks, 3 weeks? Is it 5 years? Is it 1 year? And when you normally planning, I'll tell you my experience as a CEO, the board always 5 years. Forget about 5 years. We don't know what's happening in 3 weeks. What will we do with a 5-year plan? And of course, are there any opportunities? And Shauvinik, as we were discussing yesterday, talked about some extremely good opportunities. So, we have on call many people, but I'll pass it to you, Alok, to kick it off a little bit. Just for people who don't know Alok, he's the CEO of Global R&D, Lupin Pharmaceuticals. He's also the CEO of the US. Previously, he was CEO in...
Hey, Anjan, this is Sunil here. Given that this is the first time we are trying out this Zoom session, let's try to see some etiquettes we have. If people who are not speaking, can we please go on mute? Because we are having this session where the person who is speaking kind of gets the screen. And if there is some kind of a background noise, it kind of disturbs the whole sequence. So I'll really appreciate anyone who is not speaking, please go on mute. And whenever there is your turn, you would like to speak, just unmute that button, which is, I think, on the bottom left of your screen.
Everybody followed your instructions immediately. I think
yes, please.
Everybody's now instruction following mode right now.
Yeah. So, thank you very much. Thank you, sir.
So, Alok, of course, Lupin is one of the largest generic pharma manufacturers in the world. And of course, at the center of this crisis. So Alok, would love for you to come in and share your perspectives for a few minutes on two things. One is, most importantly, you as a CEO, what's happening inside your company? How are you dealing with your employees? How are you managing the conflict between keeping the business going and keeping your employees coming? You have factories running, just as many people here have software people who have to actually run stuff. In addition, your perspectives, you're the largest generic manufacturer, and you're also in the center of where this is going in terms of a vaccine, etc. That we can all read, but more importantly is, how are you dealing with it from a company standpoint, running such a large pharmaceutical company? So over to you, Alok.
Thanks, Anjan, and thanks, Sunil. Others, Raman, pleasure to be here again, to be reconnected with you. So as Anjan was saying, I run Lupin Pharmaceuticals in the US and globally run R&D and biosimilars. Also have the pleasure of running the Pharma Association in America for the industry. So that's actually taking at least 50% of my time these days.
Alok is not only running it, but he's the president of the Pharma Association in the US and the first Indian to become the president of that.
Thank you, too kind. So I think right now we're in the eye of the storm as an industry, and for various reasons. But obviously, as a generic pharma association, we are focused now on bringing essential medicines to all the patients ASAP. But I'll come to that a little bit later. I think the first question that Anjan, you posed in terms of how are we dealing with this as a pharma company, given that we have factories, R&D centers, offices, and as various cohorts of folks unfortunately get diagnosed, which we have a few positive cases in our midst. It creates, and thankfully we had our crisis plan in place. So what we are doing as we speak is essentially we've categorized employees based on their self-reporting of symptoms. That's the first and foremost. So we have to take care of our employees wherever they might be in the field. We have a small branded business as well when they're meeting HCPs or healthcare professionals in the US, and obviously that's under lockdown right now. But as we look at office-based, or as we look at those that are working in our factories, that's very critical, and we've got to keep that running. So how do we achieve that was the first question we posed ourselves, knowing that this is coming our way. And globally, from our partners in China, we were closely in contact with Wuhan when it spread, a company called Wuxi Biologics, which is a partner for us. They really led the way on how to set it up back in mid-January. So we started learning from them a little bit. The global board has several folks from from the US, including one from the Princeton area. So I met with him sometime around end of January, and that's when we started talking, and we knew that this is coming our way. So thankfully, we started preparing our crisis plan, where you ask employees in the US. Obviously, you can't do a thermal scan. All your employment, lawyers would advise you against it, just given ADA, the American Disabilities Act, for example, that would not allow you to do that. And you can certainly do that in India and other places around the world, in China as well, but not here. So we created a self-reporting symptoms kind of tool, right? So you can create an app, you can create a tool where you ask employees to self-report symptoms on a daily basis. Employee ID, HR obviously controls that. So we started doing that, and we've categorized employees. I'm giving you a more kind of practical insight and see if that resonates with you, but we've created a 5-point scale where, say 5 is someone who's youthful, no underlying symptoms or underlying conditions, have never been in contact to the best of their knowledge with anyone who's positive, is not showing any symptoms, whether it's cold-like, flu-like, or corona-like, right? So that's kind of 5. On the other extreme is a 1, which is, obviously someone who's presumed positive, waiting for the results from CDC, because that's what's happening right now. Hopefully that'll change. And then the 2, 3, 4 are interpolated appropriately. So these are folks with symptoms, or either cold-like, flu-like, etc., or who've had primary exposure to a corona patient, COVID-19 positive patient. So that's kind of how we've triaged our and honor code. Obviously, we go by how the employee is feeling. Obviously, everyone's getting paid, including operators, which including the temp employees. I made that decision that they have to be paid for as long as the crisis exists. And they're working with us. So while as we had our first 2 cases or 3 cases last week, I took an immediate shutdown because folks were on the edge. So we took a immediate shutdown, and this is in Somerset, New Jersey, for the next 8-10 days. And we've kind of collected the data and triaged all the employees. So now when we reopen on Monday, the 23rd, we would open with obviously folks who are healthy, where we can be assured of the contact, and the employee safety is in place. The site safety was also important to us. That's the second thing that we are dealing with, that we've actually compartmentalized these various groups: office-based, R&D based, or operations based, and they set up their cafeterias differently, so that they're contained. The category 5, the GMP employees or manufacturing employees, are obviously distanced from rest of the employees who might start to come. Now that might not happen, but that's the plan. That's the crisis plan. So the essential workers, I think, have to really be protected. Over time, you realize it's only about 1/3 of your population that might be fully there, because 10% might show symptoms or might be presumed positive. Those in the middle might not be feeling 100%, or might have someone at home who's not well. In which case we ask employees to stay at home. So at the end, you're solving for that 1/3, and you want to make sure that you've got a critical mass for the essential services which require showing up at a plant or being outside. So that's kind of the site level safety that we've put in place. Then separately, we are, and I'll pause. Let me just say a couple of minutes, and I'll pause for questions. And then we've obviously looked at supply chain, which is critical for us. We are the largest makers of Tamiflu or oseltamivir, the antiviral. We also make HIV antivirals, which, as you might have heard, rightly, and some even exaggerated in various WhatsApp messages, that folks are espousing that there are these various concoctions. Some of that is true, some of that is not true. I can answer those questions, but there are antivirals as well which are potentially useful. Also malaria and tuberculosis, anti-infective drugs that might eventually become part of a cocktail for those that are hospitalized. And so that's the supply chain piece that is critical for us to make sure that globally, whether it's our plant in Europe or India or here, that we are able to supply these products to the wholesalers, which is, McKesson, ABC, which, Cardinal, those three are about 90% of all volume that moves in the US. So we are working closely with customers, and that's the fourth thing, area where we are ensuring that they are set up with their logistics partners, UPS, DHL, etc. Trucks are pulling in on a daily basis, and we're working in overdrive, making sure that the drivers of the logistics companies and the receivers at these various warehouses across the US are following protocol, because all you need is a one-person outbreak at a large plant at the UPS central warehouse in Louisville, where literally trillions of tablets land up every day, triaged at UPS in Louisville, Kentucky. We don't want any outbreaks there. So I had a chat with the UPS CEO and Senior VP of Healthcare this morning, just making sure that they can assure us as an industry that they're doing everything they can to make sure they don't have an outbreak. So that's on the customer side. And finally, fighting the good fight against COVID-19. It's unfortunate that several programs were shut down a couple of years ago, part of NIH and CDC, where there was work being done on novel viruses, novel SARS, Corona, across different, serum types and so on. So that's been accelerated in the private sector. The first patient, as you know, got dosed the other day. So fingers crossed, and we are, doing everything we can, working with academic institutions that we partner with, where there is some work being done in that area. So hopefully, there will be a range of vaccines, and I think will be out there. We'll try them across different patients, and some would be more successful than the others, so that we are ready, hopefully in the next 6-9 months, if not 12. So those are about 5 things, Anjan, that I'm focused on right now.
Let me unmute myself. So thank you so much, Alok. What I would love to do is to have this as a discussion, and people come in and come out. And Alok, that was very useful. I'll come back to you in a little bit. If at the end of this session, or if in each of these sessions, we can collectively pick up even 1 or 2 things that we feel we didn't know before, I think I would count that as a success. One thing I picked up is, paying temp employees. I think that's a fairly an important step. But I'll go around a little bit, and I'll come back to you, Alok, in a little bit. How are customers behaving in this current situation? I feel that for the first few days, maybe the customers weren't customers, they were individuals managing their family and themselves. They're just beginning to react as a company. I don't know if Jyoti, you or Badri, you have a few inputs on what you see from customers. Anybody else? Please feel free to put a chat, raise a hand. Neha, I would love to ask you also. Jyoti, why don't you go ahead first?
Before that, Anjan, before we ask that, can we ask few questions to Alok? He has given us a lot of inputs, how they are doing. So I had few questions. Can I go ahead with asking few questions?
That would be excellent.
Okay. I just wanted to ask Alok, you said you started this self-reporting symptoms that you made on 5-point scale, right? So when did you start this whole process? Was it a month before, 1 month earlier, when you came to know about the Wuhan, China thing? That's when you started, or recently you started this program?
So, Jyoti, good question. So this was about 2 to 3 weeks ago. We started thinking about it, we designed it, but actively we started tracking, especially the manufacturing staff, only about 3 weeks ago.
So how are other people handling the health of employees walking in if you can't take temperature? Or is it purely based on self either reporting or self-regulation?
Okay, yeah, at our place, we have done two things. One is we have, because we have less number of employees, so we are all working remotely. So that is the action plan that we put in place, and at the offshore centers that we have, um, last 10 days, we were doing the self-reporting that we were doing, and I think from next 2 days, we will start having employees work from home in offshore centers also. But some essential people, they would be coming to office and, taking care of certain precautions.
So Neha, I know that you have a poor connection, hence can't come up on video. You have 4,000 employees across the world. And how are you handling the employee situation as it relates to them doing their work for the company as well as for your customers?
Sure. Can everyone hear me okay?
We can hear you absolutely fine.
Okay, great. So, I mean, just like everybody on this call, we're struggling with, how to do that most effectively. But for us, it was a little bit different. How, it was kind of constant communication with the global employee base that we started a couple of weeks ago, probably a little bit too late, to be honest. But in our case, because we have a very global employee base, we have people in Shanghai, a couple hundred people in Shanghai. In Mumbai and Hyderabad, we have over 2,000 people. And in Prague, in London, we have a few hundred. So in our case, what was driving us was actually in each one of those countries, first, of course, China, then of course, Europe, and Prague specifically, not so much London, because those of you who have read there, UK is going down a different path so far. And then, of course, India. So driven by the government regulations, which was we're shutting down, we are not mandating people to work from home. In Prague, they said anyone with children, the schools are getting closed, so you don't need to go to work. So those things were actually driving our communications and our strategy most up till, I would say, a week or two ago. And I think because there was so much activity in those countries with respect to the government and what those communications were, it was easier for us to kind of follow suit. And then really for everyone to self-report. We actually have a positive case in our Prague office. We shut down the Prague office on March 10th. The person became presumed positive on March 12th. So now the whole Prague office will have to, at least the people in contact will be getting checked. So I think for us, it's been very much government has been the local or federal governments in those regions have driven it. And we're following suit along with the customers. We have some customers, very large companies, who took the early decisions to shut down or work from home. So it was a little bit easier for us. But to bring up the question, how do we ensure people are self-reporting? To be honest, I'm not confident that everyone is self-reporting. I heard people were in my Clark office, which is our headquarters, which I haven't been to in 3 weeks. I heard somebody was coughing, this and that. So I to be honest, I don't have that confidence. And I think, the numbers will continue to go up and our cases in our company will continue to go up.
So Suresh just asked a question. Thanks, Suresh. Is that in terms of culture on self-reporting, one is reporting if you are not well. Other is reporting if somebody else in your family or in your close circle is not well. So Alok, does your questionnaire include that also? And how are other companies dealing with it?
Yeah, so in our case, it does include, the well-being of family members or guests who might have been hosted at your home. I think to the best of our ability, you try to get as much information as possible. But to Neha's point earlier, there's never a complete guarantee. So often we also encourage, so my Florida office, for example, Naples, we had somebody who's get off a cruise ship sometime back and show up and everybody went, whoa, so, so nothing held against the employee, but we actually, sent her to her primary care doctor, got her checked up, and then she stayed in quarantine for at least a period of time, not 2 weeks, but maybe about a week, and came back. So if you see, I think it's very important to point that out politely. So, I'll give you my example. In my own case, I had my HR director, and he showed up with just a sniffle, and he kept doing it throughout the day. And the stuff he knows, I said, look, you've got this thing going. We're enforcing it. I know you're okay. You feel okay, but why don't you just stay home? And I just called him again in the evening that, look, Prakash will be okay if you don't come tomorrow. So I think we have to do that.
No, absolutely. So, Sanjay, how are these massive, large organizations with liabilities which are coming down from all over, like Citibank, handling it? Your perspective, Sanjay?
Yeah, so I just got off a call with OCC. I'm on the task force for financial services contingencies. So three things they're doing. One is they have asked people who do not need to be in office to be working from home on a global basis. So they're not discriminating by country. Even in India, they're asking you to do that, number one. Number two, they've broken up the teams where people have to be in office into two teams. One team comes in 1 week, the other team comes in next week, and the team that doesn't come in works from home. Third is no face-to-face conferences or meetings allowed, where there's no external person. So you have to do it all through, even if you're sitting in the office, you can do it through phones or through Skype or Zoom. Actually, Zoom is what's being preferred right now. The last thing that they did was they've also asked everyone not only to self-report, but let's say, and I can tell you about State Street, and I think 7 banks have adopted it, that if you're home, you need to disclose if you're doing, first of all, business travel is totally requires a sea level.
Can you put yourself on mute, please? Yeah. Jesse, if you could please put yourself on mute. Yeah. Or Sunil, if you can. Yeah. Thanks, Jesse.
Okay. So the sea level, so any business travel requires sea level approval. So no one has the guts to even put it up to that level. The second thing is, even if you make a trip on a for a personal reason in America, anywhere in the world, you're supposed to self-report that and quarantine yourself for 2 weeks after that. So that is how they are trying to control this. And the OCC is very, very worried about the supplier risk management on the IT side for the information technology people, the supply chain, what's going to happen. So the disaster recovery have kicked in, but clearly they are, even if you're in the office, you cannot go into someone's queue and sit down. You cannot go into anyone's office and sit down. You need to talk via phone or through chat.
I'll come. Thanks, Sanjay, for that. I'll come back on the topic that you have raised a little bit in terms of the length that we need to go. Badri, quickly, your points on how it is impacting employees. Before that, Jesse, we're just talking about what different companies are doing in terms of employee communication and employee, sort of parameters of behavior. So I'll request you for your views. So Badri, go ahead.
So yeah, okay. So our operations mostly is in India. So we have a small presence here in the US, and we've been remote for the last couple of weeks. And initially in India, back in mid-February, when the reports were coming out of China, actually early February, we kind of put in some practices in making sure that we have enough sanitizers, we maintain a clean environment in the office. If somebody is sick, they go home and all that. It's last week that we really started talking to our Indian operations about, hey, what do we do if we have to work remotely? And we didn't have we had plans for a few people, but not for the entire operation going remote. And we did initially face some resistance. There was a sense of complacency. And hey, it's not as big here. People are still going to movies. It's not a big deal. And so, as the executive team, we had to actually put our foot down and say, no, you are going through with this plan. And we actually saw a big difference between Friday and Monday. The mindset has changed, and things were really starting to get to a standstill. And actually, employees started coming up to managers and saying, we're taking public transport. Can we work from home? We don't want to get on the bus. We don't want to get on the metro. So they started seeing pushback from the ground level employees as well. So we have actually put in place to have, we're a small team, about 75 people. So we have put in the plan to have everybody work remotely. So we are executing on that. In the next 2 days, we should be completely done there. interesting challenges that we've never had before. Things like not everybody has laptop. So we said, okay, let's try to find out. Sorry, any questions?
Suresh, can you put yourself on mute, please? Yeah, sorry about that.
Okay. So, things like making sure everybody has laptop. Well, 2 days ago, we said, okay, we can rent laptops, and we had everything in place to go get it. This morning, they said, okay, laptops are no longer available. So we have to kind of adapt to that, and we're working on getting people to take their workstations home and work with that, making sure people have reliable internet connectivity at home. Little challenges that we take for granted out here in the US, making sure that that works effectively in India is a challenge. And also, given the way people sit, in the close proximity in the offices in India, it's really not practical to just have some people come in and not have others come in. So we've kind of made it the practice that everybody is going to be working from home and working through the logistics of that. The other thing we've also done is we have identified critical roles, critical employees, customer facing leads, and so on. And for everybody, we have identified backups to say if a certain person is not available for an extended period of time, 2 weeks, 3 weeks, a month, because they are out or they have to care for a loved one, who's going to take over. And we've also made it that a manager cannot be the backup for a reportee. It has to be somebody under them. So things like that based on the roles that they're doing. And we're finding that giving us a lot more comfort that we can actually handle this and really start working in a remote fashion. And we'll see. The next we should roll it out this week. So in the next week or two, will tell us how successful we are.
Badri, thanks for that. Alok, there's a question for you on the chat. If you can answer that on chat. Jesse, I'll just ask you for your what you are doing with employees, and then Orko, I'll go to you on something that just came up. Is this an overreaction? Is there reason for us to believe that we will run out? There was a huge difference, Badri, you mentioned between Friday and Monday. Is there going to be a huge difference between Monday and Friday? In which direction? And this Friday and next Friday, and we're talking of 6-8 weeks, etc. And then Mayur, I'll ask you to bring up the question that you asked on chat. Is okay, we are doing everything for employees. What are we doing about profits? So Jesse, any reflections from you, and then I'll move from there.
Yeah, Anjan, sorry, I joined a little late, so I might run the risk of actually repeating what has already been said. We actually are looking at it from a global perspective. We have customers in US and Europe, and then we have operations in US in 6 different locations. Every one of those locations is getting impacted differently. As you know, Northern California already is what we consider to be level 4, where all the employees are prohibited from leaving their houses and coming to work. The rest of the locations in US, we are operating at level 3, which is where everyone is strongly suggested to work from home. That doesn't mean that they're prohibited from coming to work, but we are basically unless you have a very mission critical work to be in the office, you should not come to the work. That is from the employee's perspective in the US. India is a slightly different story because India is running about 2 to 4 weeks behind United States, and US is running about 2 to 4 weeks behind Europe right now from the prevalence rate from an infections perspective. So we can learn a lot from what happened in China, what happened in Italy, then Spain, and now currently what is happening in France. There is a strong possibility that the same thing will happen in US in the next 2 weeks. And India is running 2 to 4 weeks behind that. So from that perspective, in India, we have only gone to level 2, which is we are giving people the flexibility, and we have made sure that from an infrastructure perspective, every employee has flexibility to work from any location that they want. So we have tested all the hardware, the software, access rights, security protocols, all of that from a work perspective. The thing that is, we are very fortunate that most of our customers are in the life sciences industry. And, the life sciences industry will get impacted like many other industries, but perhaps not nearly as much as, let's say, a retail, a hospitality, a travel, and so on. But we are expecting a pretty significant impact on the customers as well. If, this kind of not working from your offices lasts for 2 to 4 weeks, there will be some damage, but not significant. The biggest risk is if this goes on for 2 to 3 months, we see or expect a very significant drop off in the revenue pipeline because customers are going to start getting impacted on budgets, and more importantly, in making decisions on any large initiatives. So we're keeping an eye on both the demand and the supply side.
No, that is pretty. That's a big $1 million question. So, Orko, over to you. You are a PhD from Princeton in chemistry, and you've been studying infectious diseases with people in Princeton University for a long time. Are companies overreacting? Are countries overreacting? Is it the politics working? And I know that we shouldn't deal with what's really on the news, but how does it impact how we should do our long-range planning is really my question.
Yeah, so I stand in a very interesting intersection of both academia and business. The straight answer to your question, Anjan, is that no, we are not overreacting. This is exactly the appropriate response. Perhaps it's a little bit delayed, but nevertheless, this kind of reaction is appropriate. So our research, we've been studying these kinds of things for the last 7 years. And essentially the group at Princeton is called Global Systemic Risk at Princeton. And it's a cross collaboration between multiple areas of the university, which studies risks to humanity from different perspectives. Pandemic is one of the perspectives, but risk to food networks, risk to energy networks, risk to supply chains, these are all related systems. And when one system goes down, all the other systems fall like dominoes, right? So, risks to any system has a potential ability to create contagion across multiple systems. And, so the key question that you're asking is, how long is this going to go on? Now, academics are not very good at predicting stuff, and they are risk averse to predicting stuff, but here's my prediction. So the problem over here is really that humans don't understand what an exponential curve is. Most of the way humans look at growth is all linear, right? And so it's difficult for humans to understand that exponential curves have the property that most of the time you don't see anything. But then on the last day or the second last day of full scale blowout, you'll suddenly see things happening. So changing the nature of the exponential curve is what's critical. And what you have to do is really attack it as early as possible and stay with it in order to isolate infected populations as quickly as possible. So a longer way of saying this is not an overreaction. And just isolating the infected parts of the population as quickly as possible is sort of essential to all business leaders. Anjan, do you mind if I just mention a few things about how our company has reacted to this?
Absolutely, please, Arko.
So I don't know if people have seen the McKinsey report on the virus, but I'll be happy to sort of send it out. McKinsey has a nice report to say what is the business impact going to be. And the business impact is I'm reflecting sort of what Justice was saying, that there are two scenarios, right? Either the situation can get much worse before it gets better, or the situation keeps getting worse right from now, right? Because large part of the human population has not been exposed to COVID-19. So as a result, there's a possibility that the exponential curve sort of starts from now. McKinsey's take on this is that it is going to get much worse, right? So that from a business perspective, there's a reforecast that's required. I mean, this is my interpretation of what McKinsey is saying, but essentially the suggestion here is that we need to reforecast the revenues because things are going to get worse, right? Things are going to get worse, and until at least the next 2 to 4 weeks that we have isolated the populations that are actually infected, we don't know, right? So the best opportunity here is to play it safe and social distance all your employees, right? So that the exponential curve actually starts sort of flattening out, and and expect that there's going to be a revenue impact to your business.
Orko, can you just share the drum example that you shared with me? I know all of us are very intelligent people, but just share that.
So let's say you have a jar with a bacterium on it, and the bacterium is doubling every day, and it's so in 30 days it will fill the jar. The question is, when will you notice that the jar is becoming full? Raman, you want to take an answer? Guess.
So on the 30th day, the jar is full. On which number of days the jar
is half full?
So I would guess it's 29 days, it's half full.
Yes, till the 20, exactly the right answer. Till the 29th day, you don't even know you have a problem, right? And this is the danger of exponential curves, right? That if I talk to our employees in India, and they say, "Sir, like nothing's going on outside. Everything looks fine." That's exactly the point where you have to react on an exponential curve when everything looks fine, because it actually isn't fine, right? So that's hopefully that example about an exponential curve was useful. All right, go ahead, Anjan.
So Mayur, I'll ask you to ask your question, and then Shovanik, I'll move to you, because we are all looking at, we understand the situation. It is grave. We are not overreacting. And we have spent 40 minutes talking about the most important thing is how to manage the health of the employees, right? And the fact that it is long. So Mayur, if you can ask your question and we'll get a few inputs. And then I want to move to Shovanik to ask you, are there any opportunities that are coming up for businesses in this situation? We will continue to do everything for our health and employees, but are there any things that we can take advantage of, which is not the right word to use, but I'll come there. So Mayur, why don't you ask your question?
Sure. Thank you, Anjan. I appreciate that. I think the biggest concern is this. A lot of folks that are on my grad school chat from Columbia, they're in the C-suite. They're either CIOs or CISOs. And a lot of the conversation that I'm seeing them all having is measuring productivity right now from work from home, especially over the next 4 weeks. And basically what they're doing is a lot of consultants which are on billing, they're putting on furloughs for right now. And then they're going back and they're looking at their resource strategy and management planning programs and basically trying to see which employees they actually need, which roles, and they can actually move out of the Northeast and move to other regions for more cost efficiency. I think that's how they're looking on a proactive angle to try to see what work they can pipeline out and move away. Unfortunately, that's what's happening, right, at high level conversations, and because companies are going to look for ways of saving in order to maintain profitability throughout the rest of this year. Because if they have, obviously Q1 is going to be a negative quarter all across the board, right? Q2, you're looking the same exact way, but at least if they could try to plan appropriately, they want to get back into profitability by Q3, Q4, and early Q1 of next year. Have you guys heard any conversations like this or noticed anything that's like this? Obviously, all of you have a lot more experience than I have, especially if you guys have seen the 2008 and the early 2000s as well. So it's always good to pass this down.
Anybody wants to pick it up?
Yeah, I'll pick it up. So, in this call was also Jeremy Siegel was there, right? And his basically perspective, and I think we heard McKinsey. And McKinsey is good, but I think they do it based on theoretical models, in my opinion. But Jeremy Siegel's point of view was 2020 is wiped out from an earning perspective. Negative, flat growth for US, negative 0.05, and I think there are various elements for China and everywhere else. But the cash will be worthless as it relates to earning any kind of interest in the bank. So people will be investing into the equity. So they feel that this will be a whiplash back. And 2021, the demand, 75% of the demand is being deferred, is not being canceled. Let's put it this way. That is what his Jeremy Siegel's suggestion was. If people do not know who Jeremy Siegel is, he's one of the few Wharton professors. And in this meeting was also the task force of 2008 for the financial services disaster, which I was part of. We were about 9 people. And there's no issue with the banks. There's no issue on providing liquidity. The Fed has opened up $1 billion, $750 billion. They've stepped in and steadied the commercial markets, the money markets. So the estimation is this is going to last a month and a half, 2 months. After that, you can say the 2 quarters is a wipeout. and then after that the recovery starts. So that is what their perspective of this is a washout for 2020, but the revenue, even though it will be deferred, is not going away, and the equity markets have become a lot more tolerable. Now, why is equity markets important? Because as the equity markets going up, the sentiments builds. Everyone thinks very happy about what's happening. It becomes an echo of how the economy is doing, and people start investing into it and everything else. So things are getting deferred, not canceled. But if this carries on beyond 3 months, then there could be an issue.
So
So
Sanjay, thanks for that. Thanks for that. And Shauvinik, I'll just pass it on to you to pick up from where Sanjay left. Are there any opportunities for companies, and how should companies be looking at it financially? Over to you, Shauvinik.
Sure. Before that, I have a question for Alok, which is very local, uh, probably concerns everyone's health. Uh, it's about the testing of the flu itself. We spoke about self-reporting. I'll just take a minute and get his answer, and maybe someone Orko's answer to that. For instance, in West Windsor, they opened drive-by testing today, and after testing like 100 people, they were out of testing equipment, and nobody knew about it. Obviously, a secret, some kind of a clandestine operation. But again, get both your perspective on when will this is an immediate problem, right? So what is your take on that? Both of your take on that, and anybody else who may want to contribute. And then maybe we can talk about a little bit about how we at our company are thinking about this crisis.
So I think in general, from a testing standpoint, obviously that's where the U.S. has delayed and missed a trick by, obviously I think just my personal view, saying no to the WHO test, and which could have been easily replicated by a number of labs, private labs here. I think this need to be FDA endorsed, and for FDA to bless it, obviously it took significant time. So now, you're going to be behind the 8 ball a little bit. Although the high throughput testing from Roche, which is out there, and we are hoping that that would be put in place soon. And, with most of the CVSs and Walgreens, where they were saying they're looking at hotspots and they're going to deploy that where the hotspots are and send messaging. So I haven't seen activity there, but I hear what you're saying. In theory, it's not rocket science. Obviously, it's just operationalizing it and putting it where the patients are. So not doing it they shouldn't be doing it in a clandestine way. They should be doing it in a way where there's a CVS, Walgreens, and folks go and and there's a text service in each county. Folks are notified. So it's unfortunate, but hopefully that'll change very soon.
And just before Shauvinik, you come up, for those who came in late, so Alok is a guest on this group. Thank you, Alok, for coming in. He is the CEO of Lupin and heads R&D for Lupin globally and does many other things. And very, very Alok, there's also a question for you on the chat. If you can just type on chat and reply to that.
Yes, so I just typed a couple of responses back, so I'll keep doing it. Thanks.
Shauvinik, back to you.
Thanks. So, so I heard Jesse talking about Jesse kind of put it out there very clearly. We are a 3,000 people organization, and we have operations in pretty much most of the countries. A lot of operations here in the U.S., in China, in Europe, and in India. We are faced with similar types of problems that most of you are faced with. So I'll not go back into how we are solving them, because we are doing some of the things that most of you spoke about. We believe some of it is working well, and we'll see how the rest of it works out, especially here in the US. And in terms of the business forecast, like Jesse mentioned, we are preparing for a downward trend, especially in productivity over the next 2 quarters. For that, one thing that we are doing differently, which is probably contrary to what Sanjay was mentioning, we are trying to make cash cushions for every location that we have, whether it's China, here, India, just making sure that banks don't start cramping up, despite the $850 billion that has been supplied into the marketplace. Now, well, all of this is going on. It's a little. I mean, I want to be careful about how I parse this. There. So while the actual business development machine is kind of stuttering, at least for the 2 or 3 foreseeable quarters, and we work with the life sciences industry. And Alok, you and I have been introduced by a common friend called Dror Bhasan, if you remember.
Yeah.
So like Jassi mentioned, this industry is probably going to be the last one which will be impacted severely adversely in this situation. That's my take, and take it with a pinch of salt. Maybe I'm a little bit more optimistic about the industry that we are in than the others, but we still haven't had any cancellations of deals, and things are chugging along. But again, I'll go back to what Jassi mentioned. Future deals may be in peril because nobody will take decisions. And some of our larger clients are kind of in the confused state, shutting down, doing their trying to do their own defense mechanism. But as that engine slows down, where we are seeing some opportunities are in the M&A side. It's amazing how fast some of those things are moving. It's only been like 2 or 3 months, but we are already seeing some of our partners, especially private equity companies, coming up with non-essential deals, non-essential to their strategic deals, trying to see if there are buyers for it or not. So we as a company are going to focus on it, and are going to use our cash in trying to see if we can potentially make reasonable, at least start the conversation of acquisitions over the next 2 quarters with some of our partners. And outside of just partners, we're also looking at it, as a direct approach basis, going to people that we know and seeing if there are some underlying opportunities. That's the way we are moving towards it, and we'll see. Time will tell whether that strategy is successful or not. But we believe, like someone mentioned, I can't remember who. I think it was Sanjay who said that the demand will be pent up and it will come back as a whiplash. So there will be some underlying opportunities over the next 3 or 4 months.
Yeah, go ahead. Somebody has a question. We had targeted 45 minutes to an hour. We are at about 51 minutes. Arun, you have any inputs on what's been discussed? And before Arun, you go ahead. Any questions from anybody? It's in their mind. Any other topic that you want to just put in front?
Anjan, this is Shekhar. Just a thought coming in. I know Shavanik, you and earlier folks also talked about potentially demand being just held back and eventually will come back. The thought I have at the end is, while for many of us who are in the technology SaaS-based company businesses that may be true, our customers themselves or their customers in turn may be in consumer businesses. And so for the next quarter or second 2 quarters, when the actual consumerism goes down, whether it's restaurant industry or conferencing industry and everything else, a lot more of our end consumers may be having a lot of cash shortfall. So I actually expect it's not just a couple of quarters of demand shortfall. It wouldn't necessarily come back. It's not a backlog and just a delay. It's actually loss of economy or revenue in some shape or form for all of us.
I think that's anybody has an input to what Shekhar just mentioned. Suresh, any take from from you on this? Is it a delay or is it a lost revenue?
Anjan, difficult to say. In fact, since we don't have that kind of a view, I don't think anybody can really say that with any amount of clarity. So I think it's a
future will tell.
It's a guesswork. I think it's a best guess situation in this case.
You know, one thing somebody said that, you know, every store is out of toilet paper. Certainly, there's no extra use of toilet paper. Toilet paper consumption for the year will remain the same. It is just that it's being hoarded somewhere. On the other hand, tissue paper, somebody can say there'll be an excess use of tissue paper. So that way, I think we'll have to see how the industry grows. We have about 5 minutes left. I'll pass it out to you, Arun, for your take on some of the topics and any other questions.
Anjan,
yeah, go ahead.
Can I ask?
Jesse, go ahead.
Yeah, I have one question. I know it's probably too early and it's a very pessimistic view. Having said that, you know, what I said earlier, we think that we're fortunate to be probably one of the strongest industry segments of the whole market. But having said that, love to hear people's thoughts. Has anyone started thinking about belt tightening, whether it's a hiring freeze, whether it is cutting cost, and if so, to what magnitude are people thinking about, or is this too early to think about it? Because, and the reason I'm asking this question is, you know, I'm old enough to having lived through two major crises, the 99 to 2001 when the tech bubble burst, and then the financial crisis, 2008, 2009. And the people, especially in the technology business, who got their head handed to them, were the who did not change assumptions. And they continue to basically, you know, were gradual in terms of changing their assumptions about the business outlook, their cost input, and their revenues and profitability. And they're the ones who took it on the chin. So since this is that very kind of a relevant group, since we have that in common, would love to hear some thoughts. What are the current thoughts on that?
So Alok, can I pass it to you? You said earlier that you're going to pay the temps, continue to pay the temps, etc. So where is profit coming in? Where is business coming in? Alok, your take, and then anybody else.
So I think, by the way, good to see you, Jesse, and couldn't quite see you. The old Jesse is in full disclosure, old friend of mine. So great to hear your voice. So been in the industry for a long time together. So I would say that, you know, just given that in the pharmaceutical industry, you know, perhaps while we have acute pressures as a listed company, of course, there's a quarterly pressure and profitability as well. But by design, I think we're set up for the long game, and we try to set ourselves for the long game. You know, obviously the R&D investments are significant, about 10-12% of global sales. So there is no way that is going to be reduced there, and also the manufacturing costs and investments that we make. So I think the view that we've taken is just, you know, stay the course with the employees, take care of the employees. I just had a call today with you know, the promoters a little while ago, and you know, what we discussed was stay the course with the not just the employees but the temps and all the resources, people who leave our building every day and then come back the following day. So make sure that they do come back, and the plants would still be here, the machines would still be here, and the need for addressing the unmet medical need with patients would always be there. So I think, you know, if you can sustain without cutting and taking a short-term view, that would be ideal to preserve your business model and not challenge the core assumptions, be with your employees, you know, because you will soon be again in the war for talent if you mistreat your employees at this time. So I, you know, that's kind of our view. But, you know, I agree with everything that was said, that there will be some pressure, you know, a couple of quarters out, and folks would do any number of things. But I would stay the course.
Any other inputs on this very, very important topic Jesse raised? Arun, go ahead.
Yeah. No, yeah. Hi, Anjan, thanks. I mean, my view is that one of the challenges is, of course, everybody's going to be working remotely. I mean, there's a big chunk. Like, we are a tech company; we've been working remotely for a long time. But many other companies, and the only people who are going to be, forced to work on site are people like in healthcare and people who can't avoid but have to work, like doctors and nurses. I mean, these are the real heroes in this crisis, actually, right? So a lot of credit goes to them. Most important thing, of course, for all of us is to stay healthy and to be able to ride this crisis out. And as an entrepreneur, somebody was asking me, is this a good time to create a new startup? And if you really go back and look at the history of startups, the recessions are in fact not good times in a way. I mean, not good in the sense of, but the fact that you have to be a little bit contrarian in the sense that there are huge opportunities that are going to be unleashed. This is not a good thing in general for the world, but as an entrepreneur, if you can solve some of the problems, we're going to be learning a lot. There's going to be a lot of new problems that are going to surface. So as an entrepreneur, there are going to be a lot of opportunities to solve some new problems which didn't exist before, right? The other thing is, of course, resources are going to be, less expensive, unfortunately, right? Because there's going to be layoffs, there's going to be people who are looking for jobs. So in a way, you can do good by creating more value and make a positive difference. So in that sense, as entrepreneurs, we ought to think about how we can give back, how we can create more value, how we can create something, how we can solve some of these new problems. So that's basically my take.
That's very good. I'm aware that we have 1 minute left before the hour, and I don't want to pass it on. Jyoti, go ahead.
Yeah, I would like to add my view. Maybe I didn't realize it, but I started my company in December of 2009, and that was the financial crisis when it was. And I always thought that if you look out for an opportunity, you get it. So I feel the hurdles will be there. There would be, opportunities will go. You will not have that much growth this year. But there will be opportunities where we can think of like automation. Each company can think of some of the critical issues which they can automate and have people work remotely. And that could be the new initiatives that can come along.
I think remote working will increase enormously. I think there is no question, about that. Any other sort of points, inputs, questions, anybody's mind?
Anjan, I have one question, which is directed towards Jassi and Alok. Is the critical thing over here is the availability of a vaccine, right? And as far as I know, other than Gilead, we don't have a lot of sort of vaccines in the pipeline. Is that correct, or is that a wrong opinion?
We've got Moderna, Arca, so a couple of other companies with a mRNA vaccine, so we just went into trials. Obviously, Gilead and Sanofi, Regeneron are trying their own versions as well. So I think Moderna's is a different, as an mRNA vaccine. That's obviously different. It's not just, it's not the live virus, right? So, so we'll see how effective that is. I think the question with that vaccine is, the duration. So it might be effective, in a transient kind of time frame. I was talking to a chair of bioengineering at MIT this afternoon, and I asked him that question which you just asked to get his views. And he feels that it might actually have activity for 3 to 6 months, coming from a guy who helped on the Ebola vaccine. This gentleman. So the other ones. So it might give us a short-term hit, which might be important for the cold, the winter that will come in about 9 months. So that's kind of the risk we are sensing as phase 2 of this. So if we have this vaccine, even if it's active for a few months, might be helpful. And then the longer term, 12 to 18 months out, a Gilead or or others, the other 2 companies I named, might work. There are companies like Wuxi Biologics, for example, which are partnering in Singapore, the government of Singapore, which are also working, through their programs. But yeah, that's about 6 or 7 who are serious players.
So quickly, let me try to wind this down. I know we are over time. A couple of quick questions. One is, was this a useful discussion and a useful format? So just a question overall for any reactions.
Absolutely. This was definitely great insight, especially to just know exactly where everyone's head at and what's going on with the market right now. I think we're in a confused state about what's to happen. And I've never actually experienced anything like this firsthand in my life. So, this is kind of dramatic. It's actually kind of scary as well, because my parents are in their early 60s. So it's going to keep them in quarantine and sitting at home and trying to keep them occupied without going crazy, right? So I think this is definitely great for us to all talk and express what's going on. Sure.
There are many people on this call who are not far from early 60s. So we
So Anjan, if you wanted a use case for the idea that you and Raman had to put this group together, I think this is it.
I think Raman, Raman, you really spearheaded the whole thing. And also this format worked out because it's not too much of an investment in time. It straight away gets into, because we don't want to have a glass of wine and stuff like that. We want to actually talk issues. So it's second question. So thanks for that, Jesse, and thanks for that, Mayur. So second question is, given the coronavirus issue, should we continue with this maybe on a truncated half an hour every other week or every week for the next 2 months or so? Is it of use, or should we, because all of us have our own forums around. We had 5-6 topics. We picked up, one, which is employees. Is this of use, or we should have it a more monthly cadence? Any inputs, any thoughts?
This is Sue. I think, it's excellent, this chat. 2 weeks will be a good, so that end of this month will be helpful to know what others are doing with their employees. And, it's a very helpful session. Thank you, Raman, and all the team.
Thank you. So any other inputs, and then I'll pass it back to you, Raman, to give your observations. And
Alok, I just wanted to ask you a question regarding since you have people over in China, I wanted to ask, you start to see the drawdown, right? They've already started to flatten that curve, but at a really late stage, right? So I wanted to see, yeah, exactly. Exactly. So the question that I have is, whenever you're taking a look at the time frame, right? January or December was the time frame, and now we're starting to see that drawdown from them closing down hospitals. Is that the same type of time frame that we are expecting elsewhere? And I'll get back to my area, is that my parents are in India right now. So then the question is, hey, should I shift them where or what? And by the way, this has been excellent. I just wanted to say I've learned a ton. So I just wanted to appreciate everyone that's given amazing input.
Yeah, no, thanks, Krishna. I'll make it quick. So I think there's no perfect way to predict that, but I think in general, China did clamp down when they did, with brute force, and I think US is doing that now. So I think in general, the curves are roughly about the same, give or take. I think if you do time align the curves, we are right with Italy and also perhaps even China and others. So as Zarka was saying, I think folks do have a tough time, thinking through exponential curves. But, I think in this case, it's easier because we've got analogs of other countries that have gone through this. And I think if we clamp down, if we do exactly the same thing, our demographics are slightly different. So China, one thing I would say that China, if you look at the study that was just published 2 days ago with 120,000 patients study, and so their demographics with underlying conditions is quite less than, for example, the US. So there is a demographic difference. So in terms of complications and the infrastructure that we would need across all the hotspots requiring the ventilators and the treatment of the viral pneumonia with these innovative cocktails, I think China was probably a step ahead because they really just didn't have a significant chunk of those patients given the demographics. And, I think here we'll just need to to really take care of the elderly and be very careful on how we handle them.
Okay. Raman, I'll pass it over to you, Raman, to help us make sense. Raman, can't hear you.
Can you hear me now?
We can hear you now.
Okay. So thank you very much, Anjan, for your idea to have this discussion session and forum. It's really terrific. And thanks also to the group for sharing. There's a lot of food for thought, whether it is to examine assumptions, contingency planning, or even look at opportunities. There was a lot of food for thought here. With respect to the timing of further sessions on this subject, I think there were a couple of comments from Badri and Jassi. Let's look at the trajectory over the next couple of weeks. The likelihood is that 2 to 4 weeks, the trajectory will only make this subject more urgent. So I think it might make sense to have that plan a session. But in any event, I think this forum is very effective, very efficient, and I think we can have a good exchange of views on business issues that are important, even when they are not such crisis situations. So again, thank you, Anjan, and thank you to the group for being so open with your ideas. And Alok, thank you also for participating. Yeah. So good evening to all, and thanks. Bye now.
Thank you very much.
Bye.
Thank you, everybody. Thanks, Raman, Anjan, Alok.
Yeah, it's really impressive. It's really good, actually. It really helped out.
Here's Alok.